So what are some of the levers here? And I work in healthcare. I've worked in healthcare for 35 years. I've worked with just about every kind of different healthcare organization. And this is a really complicated issue, and I'm greatly oversimplifying it, okay? But I do want to give you a few of the headlines here. First of all, how we pay for healthcare, particularly in the US. We've been on a 20-year march, and we've made some progress, but the nature of payment in the US is once you get sick, then we begin paying for stuff. And the incentives are for care providers, the sicker you are, the more stuff that they can do to you, and the more money that they get paid. Health systems are beginning to shift on paying for value as opposed to simply volume of care. Health data and AI. This is where the gap, for example, I mentioned to you around pharmaceuticals, can begin to be filled. We don't know how to treat patients with multiple chronic conditions. And there's not necessarily patterns. If there are dozens of different kinds of chronic conditions, there are different permutations that people may have. This is where data and AI can be really helpful in the future. Technology, wearables, we've begun to talk about that in other presentations. But typically, if you look in the past, there were only 6 vital signs: your blood pressure, your weight, respiratory measurement, O2. Today, there are hundreds of different vital signs being evaluated. We really don't have a lot of information yet, and the science of medicine is really relatively primitive compared to many other sciences that we have. So the first 3 things that I listed are really around the health system, but that's not ultimately where the leverage is. The leverage ultimately is with each of us individually in taking personal responsibility. An example, in the US, the obesity rate is over 40%. In Japan, it's about 4%. Now, there are multiple factors that explain this, but the point is it is doable, that there are countries and nations, the cultures are very different. In the US, as I told you, the longevity is about 5 years behind the rest of the developed countries in the world. Personal responsibility, so that includes nutrition. You'll be hearing a lot of this, again, from the administration, the focus on ultra-processed foods, eating a good diet, not living on Doritos and chips, red meat once in a while. Exercise, a very key aspect, being able to be personally responsible for maintaining your weight, your personal physique.